Are you suffering from essential tremors? Is your condition with your dominant or your non-dominant hand really taking a toll on your life? Is it interrupting your function? Is it hard for you to write a check or write a letter? Is it hard for you to work on your computer? Is it hard for you to drive your car? Has it gotten so bad that you're so anxious that you just can't get better? Have the doctors done different exams on you and offered you different kinds of medications, yet they're not providing relief from your condition? Watch this brief video where you won't see the man's face. He didn't want to be seen in public. He wants to keep his condition private. But I did blur out his face, but you'll see it's his hands. You'll see the before and after video. You'll see the change that started to occur after his first protocol with me. I'm filming this video August 24th of 2019. His first exam was February of 2019, and the second one was in May of 2019. And we will see in the video that he actually had a better range of motion when he turns his hands around. And when he was holding his hands on the side in the initial video, the hand was shaking terribly. In the second video, holds his hands on the side, no shaking. It's not medications that did that for him. The man, with medications, without medications, nothing stopped it until he started this care with me. And I'll tell you the kinds of findings in just a minute. His left hand was so bad, he's left-handed, number one. He was able to write, but it was very small and almost a scribble writing. He came back to me very happy for three reasons, he told me, when he came in for a second visit with me, a second consultation for a second exam. His handwriting improved. His hand was not shaking the way it was, which you see in the video. You could see his hand holding steady. And number three, he felt his personality changed. He felt that he was less stressed. He was less stressed. He was able to be around people and not snap at them. He wasn't barking at people who used to upset him. But I think that his temper changed or became relieved because he was functioning better. In his first protocol, now, before I even get into that, I believe that these tremor disorders, these movement disorders, are caused by hidden infections and hidden toxins in the parts of the central nervous system that are not found on MRIs, not found on a DAT scan, not found on a blood test, not found on some possible nerve conduction study. We've got to think differently and think out of the box and use a different system, which I practice. I created a system called functional neuro recovery therapy. Now, I've had extensive studies for hundreds of hours in functional neurology, neurochemistry, neuroimmunology, endocrinology, blood chemistry analysis, thyroid disease, vestibular disorders. I've taken courses in biochemistry. I've taken developmental disorders, and there's so many different parts of the nervous system that I've been able to study, and in some great schools and with great physicians who are leaders in the field of neurology. Yet it still left me with a bit of not a complete understanding of why somebody would suffer, because with all the labs and hair analysis and stool analysis and blood analysis, there was not enough gain from those type of laboratories. So I had to say, what other science is out there? And I found a science that was developed by these biophysicists in an Institute of Biophysics in Germany, later brought to the US by a brilliant Russian scientist who's a great mentor of mine. And I provide a very unique system and a unique service to be able to examine the different parts of the nervous system and find out which infections and or toxins are in these parts of the nervous system that are causing a malfunction. And when we can provide specific remedies that are potent enough to get rid of those infections and toxins from the nervous system, you can recover, like you see what's happening with this man's hand. In his first protocol in February, which brought that kind of relief, again, he's left-handed, he can write better with the left hand, and his tremor had definitely decreased in that functional movement. We see a better rotation, his ability to turn his hands over. He thought it was a rotator cuff tear from years ago that caused his shoulder restriction, but it was tight muscles because stressed nervous system tissue. I'll talk about that in another video. I found in that first examination that he had in his white matter of essential nervous system, which is what controls motor function, his white matter, he had midazolam sedative chemical from a surgery in the past, and he had propofol, which is the anesthetic when they put you to sleep. He also had mercury in his kidneys. He also had mold in his kidneys, and a few other findings there, different kinds of bacteria that we provided remedies to remove the mold, remove the mercury from the kidneys, remove the bacteria from the kidneys, but also remove the propofol and remove the sedative from the white matter of his nervous system. Now I'm going to tell you, there was a study, 2 studies that I read about online, or 2 reports I should say that I read about online, where these anesthesiologists and doctors had reported that when patients who had no tremors, no movement disorders, no athetoid movements, when they went under sedation and then went into surgery, when they were under the anesthesia, they started having these jerky body movements on the surgery table, on the table. They started having movements that were uncontrollable, and they were knocked out. They did not have those movements before they went under. They had athetoid movements, they had tremors, they had shaking body symptoms. They had to use different kinds of medications to counteract the medication. They know that the medication called a sedative called Versed, also called midazolam, was the cause of the shaking body disorder. So again, I found that midazolam affecting his white matter of his nervous system, and the white matter is the motor controlling part of our nervous system. His second examination, that was after his first exam, that was after his first protocol, that was video I'm showing you, was before the first exam and first protocol, right after he completed his second protocol, before his second examination. So everything I just told you about with the kidneys and the white matter of the nervous system, that's what I found, and that the remedies provided that in that protocol is what allowed his hand to become more stable. Now in his next round, and we haven't seen him again yet, I believe his next visit is in September with me, September of 19. I found with him in his second examination that he had in his blood, I believe there was St. Louis encephalitis virus and West Nile virus. Now those viruses are both connected to tremor disorders. You can look up online if you care, type in, if you want to look up a neurology journal or PubMed or some kind of medical journal, look up West Nile virus tremors or West Nile virus causes tremors, and you'll see that there's links to it. I also found with him that was in his spinal cord, I believe there was 2 different kinds of mercury, thimerosal as well as mercury that's commonly found in the ocean. Thimerosal is from vaccines, mercury from the ocean from different fish. I also believe that he had the West Nile virus affecting his spinal cord, and the parasite from the malaria infection, mosquitoes, transfer these infections to us, affecting his spinal cord. I believe that he also had in a part of his brainstem, he had a chemical, there's an etch material. I'm able to find some things in people. There's different detective work than what you're used to with your doctors, and you probably don't hear this talk from your physicians. So again, looking at the proof in that video with that man with his hand getting better, okay? And watch other videos on my YouTube channel. You'll see other people getting better and even talking about it. People who are okay with showing their face on my YouTube channel. It's called liquid etch. There's a material, there's a liquid that they'll put on a tooth when they're gonna degrade the tooth down to put a cap on a tooth. That liquid etch material, we swallow some of it. I found that. Now that degrades the tooth. When we swallow some of that liquid that they put on to degrade the tooth to put a cap on, when that can degrade a hard substance like your tooth, what's it going to do to your nervous system when it gets absorbed into your nervous system? Listen, you are what you eat. You swallow your saliva, you drink water, it's going to go somewhere. So the liquid that got into his saliva from what they did to a tooth, that went up to the brain in a part of the brainstem that also helps to regulate motor function. I also believe that he had the tetanus bacteria affecting the same part of the brainstem which controls motor function. Provided remedies for those that I just mentioned. I also believe that he had in his cortex of his brain, he had a parasite infection, and he also had in some arteries of the brain a parasite infection. And he had another part of his brainstem called the red nucleus. The red nucleus is integral in helping us control limb function, motor control. I believe he had the malarial infection, and he had some residues of fentanyl from surgery in the past, and lidocaine, dental anesthetic, that went up from the tooth, went up to the red nucleus, affecting that part of the brainstem which controls motor function. Listen, when they inject you with a chemical in your mouth that numbs your mouth, you don't feel your tooth, you can't speak right, you can't spit right, you can't swallow normally, maybe you can't smile properly, your lips are a bit numb and paralyzed. What happens when that chemical, let me put it this way, when it wears off 3, 4, 5, 6 hours after the dental procedure, where did it go? Where'd it go? Did it just disappear? Did it go into thin air? Did you ever think about that? That's what I think about. That chemical, I believe I found that in his brainstem, which helps us regulate motor function, helps him regulate his motor function of his arm and hand. When that numbs your mouth and you can't spit or speak normally or move your lip normally or swallow normally, or What's going to happen to the part of the brainstem that controls your limb when it's some of that chemical got up there and polluted and stay there like a dye in a shirt? If you put a dye in your shirt, it's going to stay. It doesn't leave. It doesn't just disappear because I've stopped putting the dye there, or I look at it the next day or the next month. The dye is still in the shirt. So the chemical from the dental procedure got up into the brainstem and caused him some malfunction. Those are the findings. That's how I believe that we can help you get out of these different movement disorders. We've got to look at you with a different set of eyes and ears and a different set of tools and skills to be able to help you figure it out and help you get yourself well. My name is Dr. Lonnie Herman, and again, I created my unique system, functional neurorecovery therapy. The job here is to get you well. The job is to educate you about the possibilities. The job is to be able to, my job is to be able to educate you about the possibilities, give you a different viewpoint so that you can really start to expand your mind. Because once you expand your mind, you can't return to what you used to think. Once you understand what the possibilities are, and this is coming from neuroimmunology research that I did. I went through a postgraduate study that was offered by the Carrick Institute in neurochemistry and neuroimmunology. There was 125 in-class hours. That doesn't even compare to the amount of outside of class hours that I've studied since I learned how to research things on my own in that class, in that course. It was 5 courses. So that the neuroimmunology program was taught by one of the world's most recognized immunologists, Dr. Aristo Vojdani. And he pointed out to us with dozens and dozens of research papers from laboratories around the world with these scientists who were not working for drug companies. These scientists were finding and proving that there were different infections and different toxins that got into different tissues of the body that made the symptoms occur in the person. Infections and toxins got into tissues that made the symptoms occur. Now I had to go on my journey and find a way to be able to discover this in my clinic and be able to find it in a person's brain, or find it in a person's spinal cord, or find it in a person's spinal fluid, be able to provide safe and effective therapy to get it out of there. So these remedies that we make in our laboratory will get these infections and chemicals out of the system, and then we can see the body begin to repair itself. The care that I offer is not covered by insurance. If you want to make an appointment with me, this will be out of pocket. You can contact my clinic at 954-370-3100. That's 954-370-3100. And you can even, if you'd like, I'll put up the email address to my clinic. You can contact my clinic assistant and she can help you arrange appointments with me. On average, we're a 2-month waiting list for the exam. Usually the consultation, investigation, a different kind of discussion we're going to have than what you're used to having with your doctor. And a different examination than what you've had with your doctor, that is for sure. The consultation we could do via Skype or phone or in person, but that's usually handled probably in about a month period of time when you're calling, but the exam is usually about a 2-month waiting list to come in. The exam is going to be about a 2.5 hour appointment with me in my clinic, and average protocol is 2 months to 3 months that you follow at home before I'd see you again, okay? And the sooner you're better, the better it is for you, the better for me, the better for everybody out there. I want you to get better as fast as possible. I'd rather you get better so fast that you don't have to come to me anymore. I want you better so that you don't have to keep going to doctors. The point is to get you back on your feet and function the way you used to function, not to keep coming for care, to just try to cope with or manage your symptom like some doctors are doing for you or with you. You can follow me on Instagram. You can like me on my Facebook page. Put up information there on a regular basis. Subscribe to my YouTube channel. Turn on the bell for notifications so that you can find out when I put new videos up on my YouTube channel, because YouTube will email you and let you know Dr. Herman put up a new video, basically. Okay? Call my clinic at 954-370-3100. Email my clinic assistant. Either way, contact so we can get started. Okay? Thank you for watching this video. I hope this was helpful for you. If you found anything beneficial for anybody else, please share it with them.